What part of the bowel is most often affected by Crohn's disease? A. The terminal ileum. B. The sigmoid colon. C. The ascending colon. D. The rectum. The answer is A. The terminal ileum. While Crohn's disease can affect any part of the alimentary canal, the small intestine, particularly the terminal ileum, is the most common site of serosal inflammation. What is the characteristic mucosal alteration seen in ulcerative colitis? A. Thickened mucosa. B. Skip lesions. C. Cryptabscess. D. Granulomas. The answer is C. Cryptabscess. The characteristic histological alteration seen in ulcerative colitis is the cryptabscess, in which inflammation causes loss of goblet cells due to neutrophilic exudate in glandular lumens. Granulomas, thickened mucosa, and skip lesions are all seen in Crohn's disease. Frequent projectile, non-bilious vomiting starting 2 to 3 weeks after birth is indicative of what condition? A. Intussusception. B. Infant gastroesophageal reflux disease, GERD. C. Congenital hypertrophic pyloric stenosis. D. Diverticulitis. The answer is C. Congenital hypertrophic pyloric stenosis. In congenital hypertrophic pyloric stenosis, the smooth muscle of the pylorus becomes thickened, decreasing the lumen size of the pylorus. This prevents food from passing out of the stomach and into the small intestine, resulting in vomiting, which is often projectile and tends to be non-bilious. Intussusception may show vomiting, but the more obvious sign is bloody currant jelly stools. Infant gastroesophageal reflux disease, GERD, may result in frequent spitting up, but projectile vomiting is rare. Diverticulitis is generally a condition of the elderly and tends to present as abdominal pain with alterations in bowel function and mild fever. What comorbidity is generally seen with esophageal varices? A. Gastroesophageal reflux disease, GERD. B. Achalasia. C. Hiatal hernia. D. Cirrhosis. The answer is D. Cirrhosis. Esophageal varices are most commonly seen in patients with cirrhosis due to portal hypertension. Gastroesophageal reflux disease, GERD, is associated with esophagitis and occasionally with metaplastic changes. Neither hiatal hernia nor achalasia are associated with esophageal varices. What sign might indicate Hirschsprung's disease in a newborn? A. Unrelenting crying. B. Bloody stool 3 to 5 days after birth. C. Vomiting within 48 hours of delivery. D. Failure to pass meconium within 48 hours of delivery. The answer is D. Failure to pass meconium within 48 hours of delivery. While an infant with Hirschsprung's disease may have vomiting and bloody stool, the most common sign is failure to pass meconium within 48 hours of delivery. Hirschsprung's disease, which is an absence of innervation to the large intestine, which results in narrowing and constriction of one part of the bowel and dilation of the preceding segment, can be diagnosed by biopsy of the distally narrowed segment of the bowel. What tissue of the gastrointestinal tract is affected in celiac disease? A. Stomach, causing gastritis. B. Rectum, causing fistulation. C. Large intestine, causing ulceration. D. Small intestine, causing villous atrophy. The answer is D. Small intestine, causing villous atrophy. While individuals with celiac disease can certainly have gastritis, fistulas, and ulceration due to inflammation, the primary effect of celiac disease is villous atrophy in the small intestine. Villi become blunted, leading to loss of ability to absorb nutrients, including minerals and fat-soluble vitamins. Which of the following refers to bleeding from partial thickness tears in the mucosa at the junction of the stomach and esophagus? A. Esophagitis. B. Barrett's esophagus. C. Boerhaave syndrome. D. Mallory-Weiss syndrome. The answer is D. Mallory-Weiss syndrome. Mallory-Weiss syndrome refers to bleeding from partial thickness tears in the mucosa at the junction of the stomach and esophagus, often from traumas such as violent retching or coughing. This is compared to Boerhaave syndrome, which is a full thickness tear of the esophageal wall. Esophagitis is most commonly caused by gastroesophageal reflux disease, GERD, and does not present with bleeding. Barrett's esophagus refers to a type of metaplasia in the lower esophagus which is thought to be caused by chronic GERD. Full thickness, transmural, ulceration of the bowel wall occurs in what condition? A. Ulcerative colitis. B. Crohn's disease. C. Celiac disease. D. Irritable bowel syndrome. The answer is B. Crohn's disease. Full thickness, transmural, ulceration of the bowel wall occurs in Crohn's disease. Bowels may also show thickened walls, serosal adhesions, and loss of the regular folds. In ulcerative colitis, ulceration is restricted to the gut mucosa. Celiac disease results in blunting of intestinal villi, but does not cause ulceration in any form. Irritable bowel syndrome, or IBS, is considered a functional disease as it results in no known pathological tissue changes. Janelle is a 56-year-old woman who is 3 days post-total abdominal hysterectomy. She has not passed gas or had a bowel movement since before surgery. The patient starts vomiting dark brown material. The nurse should be sure to do which of the following? A. Administer antiemetics. B. Auscultate for bowel sounds. C. Report the finding to the next shift. D. Have the patient lay on her left side. E. Place a cool washcloth on the patient's forehead. The answer is B. Auscultate for bowel sounds. The patient is displaying symptoms that could indicate a paralytic ILS. A paralytic ILS is a blockage of the intestine that may result after surgery, most commonly abdominal surgery. During an ILS, the intestine cannot move food through the bowel. A patient with this condition will not have bowel sounds. Constipation, nausea, and vomiting are all considered symptoms of an ILS. The nurse is caring for an 89-year-old male who has been admitted for nausea and vomiting. His treatment plan consists of IV fluid replacement of 0.9% normal saline at 150 ml per hour, IV ondansetron PRN, IV prochlorperazine PRN, and an NPO diet. The patient starts to show signs of confusion. The nurse may suspect which of the following? A. New onset of Alzheimer's disease. B. The patient's antiemetics. C. The IV fluid replacement rate. D. The NPO order. E. The IV fluid composition. The answer is B. The patient's antiemetics. Older adults are at high risk for the development of side effects related to medication use. Antiemetics are commonly administered medications and may cause confusion, especially in older adults.